Hello, my name is Kaylee. I'm going to be your nurse today. I'm going to go ahead and provide some privacy for us. And then I'm going to wash my hands before we get started today. Okay, I'm going to look at your wristband real quick and ask you to tell me your name and your date of birth.
Santana Thompson, August the 9th, 2000.
And then your hospital number for me.
58783.
Okay, thank you. Patient identifiers are correct. Okay, so Ms. Thompson, today we're going to be doing a full body assessment. Everything's confidential and you have the right to refuse any of the assessments we do today. Okay, so I'm going to ask you a few questions just to get started. Can you tell me your name,
Santana Thompson,
your today's date,
September 8, 2021.
and then where we are today?
Martin Hall.
Thank you so much. Patient is alert, awake, and oriented, and patient's speech is clear for age. Okay, so to begin today, I'm going to start with eye assessment. I'm just going to take a quick look at your eyes real quick. Okay, both right and left pupil are graded at a 4 millimeters in diameter and are symmetrical and equal bilaterally. I'm going to turn the lights off real quick. I want you to stare directly at me, please. Okay. Okay. Both pupils were equal bilaterally and dilated and constricted with light. Now I'm going to do the accommodation test. Can you look directly at my pen for me, please? I'm going to bring it towards you. Okay. Both pupils accommodated and were equal bilaterally. Now I'm going to ask you to stand up for me, and we're just going to do the Snelling chart so you can walk 20 feet away from me. All right, we're going to begin with your right eye, so can you cover your left eye for me? Okay. So I want you to read off the first line down until you can no longer read anymore, okay?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T.
Okay, perfect. So right eye was 20/20 vision. Okay, now you can cover your right eye and we'll assess your left eye.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, D, E, F, C, D, D, F, E, L, P, O, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T.
Perfect, thank you. So left eye was also 20/20 vision. So you can come back for me. We're going to do both eyes real quick. So if you could just go back down this, starting with the first row.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, T, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, P, O, D, P, C, T.
Okay, perfect. So both eyes were equal bilaterally and both eyes were 20/20 vision. Okay, so you can come sit back down for me. All right, now I'm going to assess your ears real quick. So look straight forward. Both ears are symmetrical to the outer canthus, and both ears are equal bilaterally and symmetrical. So now I'm going to look for any external characteristics. No notable lesions. No notable lesions on both ears. Equal bilaterally. No notable drainage on each ears, equal bilaterally as well. So now I'm going to move on to nose assessment. Do you mind bringing your mask down below your nose, please? Nose is midline to the face and symmetrical. No external lesions noted on nose. So now I'm going to ask you to look up for me, and I'm going to look in your nose real quick. Both turbinates noted in both left and right nostril. So now we're going to assess your mouth, so you can bring your mask down. Okay, say ah for me.
Ah.
Alright. Buccal mucosa is present and pink and moist. No cavities present in teeth. No missing teeth noted. Gums are also pink and moist. Tongue is also pink and moist. Can you lift your tongue up for me? Okay, lower it back down. Both soft and hard palate are also pink and moist. Alright, now I'm going to ask you to say, open your mouth and say ah.
Ah.
Stick out your tongue for me.
Ah.
Uvula rises with phonation, and tonsils are present and graded at a scale of 2+. So now I would ask the patient if they wanted to do a gag reflex assessment.
Mm-hmm.
The patient declined, so I would take a tongue blade and I would stick it in their pharyngeal pockets on both sides, and if the patient gagged, she would have a positive gag reflex, and if the patient didn't, she would have a negative gag reflex. So now we're moving on to neck. The neck is symmetrical and midline to the body. I'm going to check for any skin characteristics on both anterior and posterior neck. No lesions noted on both anterior and posterior neck, and no bruising noted as well on anterior and posterior neck. So now I'm going to check for any lumps. There's no noticeable lumps on anterior and posterior neck. I'm also going to check for any pulsations. No pulsations noted. Now I'm going to check her carotid artery pulse. Okay, now I'm going to check the other side real quick. Both carotid pulses were graded at a 2+, and they were equal bilaterally. So now I'm going to osculate for any bruits. I'm going to make sure to use my bell. I'm going to ask you to take a deep breath in and hold it, please. Okay, let go. Now I'm going to ask you to do it again. Take another deep breath for me and hold it. Okay, perfect. No bruise noted in left and right carotid artery, and they were equal bilaterally. So now we're going to move on to posterior thorax. So if you don't mind, you're going to have to turn a little bit for me, please. Thank you. So first I'm going to assess the skin for any skin characteristics. No noticeable lesions and no noticeable bruising. Okay, so now I'm going to palpate the posterior thorax for any tenderness. Please let me know if you feel any discomfort or tenderness while I'm doing this, okay? Okay, no tenderness noted in posterior thorax. So now I'm going to auscultate for any, her breathing sound. Okay. I'm going to ask you to take a deep breath for me. Again. 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 Breathing sounds in both left and right lung were clear and they were equal bilaterally. So now I'm going to percuss for any CVA tenderness. So let me know if you feel any tenderness when I do this, please. Okay. No CVA tenderness noted. So now you can turn back around for me, ma'am. So now we're going to begin anterior thorax assessment. So I'm going to first begin by assessing any skin characteristics. Patient does have a tattoo below left clavicle and upper thorax. No noticeable lesions and no noticeable bruising. So now I'm going to listen to her breathing sound. Auscultate her breathing sound anteriorly as well. Okay, take a deep breath for me, please. Again. 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 Okay, thank you. Breathing sounds were unlabored and regular. And so now I'm going to move on to heart. So I'm going to auscultate and listen to her arteries real quick, or her valves. So we're going to start with the aortic valve real quick. Aortic valve has regular rate and rhythm and no murmurs noted. Now we're going to go to pulmonic valve. Pulmonic valve has regular rate and rhythm and no murmurs noted. Now we're going to move to tricuspid valve. Tricuspid valve has regular rate and rhythm and no murmurs noted. Now we're going to go down to mitral valve. Mitral valve has regular rate and rhythm and no murmurs noted. Now I'm going to listen for any bruits and go back up. Mitral valve has no bruits noted. Tricuspid valve has no bruits noted. Pulmonic valve has no bruits noted. And aortic valve also has no bruits noted. So now, before we move on, I'm going to go back and make sure I check her respiratory rate and rise and fall of her chest. So I'm going to do that real quick. Okay. respiratory rate was 22, and rise and fall of chest was equal and symmetrical and equal bilaterally. So now we're going to go back and we're going to move on to, I'm going to do her upper extremities. So I'm going to start by asking you to grip my fingers for me. Okay, perfect. Thank you. Now I'm going to ask you to put your hands out like this, and I want you to spread your fingers. I'm going to put my hands right here and just push against me. Okay, perfect. So strength in fingers was a 5 out of 5 and equal bilaterally. So now we're going to do arms. Okay, so I'm going to ask you to push against me and now pull against me. Okay, strength in both arms was equal bilaterally and graded out of 5 out of 5. Now we're going to do shoulder strength. I'm going to put my hands on your shoulders, and I want you to push up. Okay, shoulder strength was a 5 out of 5 and equal bilaterally. So now I'm going to inspect both of her arms for any skin characteristics. So okay, arm on her left forearm, there is a healed scar that is noted. No lesions noted on both arms though, and no bruising noted on both arms. So now we're going to, I'm going to check her capillary refill in all of her fingers. Capillary refill in all fingers on both hands was equal bilaterally and was less than 3 seconds refill. So now I'm going to do your range of motion in your hands. So I ask you to do your hands like this for me, and I want you to bring your fingers down, bring them back up. Okay, now I want you to put your hands like this and bring your fingers like this and bring them back. Okay, perfect. So range of motion in fingers was full range of motion, and it was equal bilaterally in both hands. So now I'm going to ask you to do your hands like this, and I want you to bring your hands all the way down and bring them back up for me. And I want you to take your wrist and go like this. Okay. Range of motion in wrist was equal bilaterally and both graded at a full range of motion. So now I want you to take your arms, and you can just bring them like this and do it like this. Bring them back for me. So full range of motion in both elbows was noted and equal bilaterally. So now I'm going to have to ask you to stand up for me. We're going to do range of motion in shoulders. So put your arms to your side, and then we're going to bring your arms all the way directly up and back down. And now we're going to bring the arms back to the side and bring them up this way and back down. Okay, so full range of motion in shoulders noted and with equal bilaterally. So you sit back down for me. Okay, so now I'm going to do the apical pulse. So I'm going to grade both of them at the same time here.
You said what?
Your radial pulse. Sorry about that. Radial pulse is graded at a 2+ and is equal bilaterally. Now I'm grading the brachial pulse, and brachial pulse is also equal bilaterally and graded at a 2+. So now I'm going to move on to, I'm going to check her apical pulse real quick and grade it. Okay. Okay. Heart rate was graded at an 86. Now I'm going to check for strength. Applicable pulse is graded at a 2+. Okay, so I'm going to ask you to lay back down for me, and I'm going to assess the abdomen real quick. Let me pull your shirt up for me a little bit. Okay, so I'm first going to inspect any skin characteristics. Abdomen contour seems to be symmetrical and no noticeable lesions except for a healed scar near the umbilicus and another healed scar near the right lower quadrant of the abdomen. The umbilicus is medial to the body and symmetrical. Also, patient has umbilicus piercing that's noted. Now I'm going to listen to her bowel sounds real quick in all 4 quadrants. Okay. I'm going to start with the lower right quadrant and work my way around. Okay. Normal active bowel sounds in all 4 quadrants, and they were equal bilaterally. Now I'm going to lightly palpate for any masses or tenderness. So let me know if you feel any discomfort. Okay. Okay. Okay, no tenderness noted during light palpation and no masses noted. Now I'm going to do deep palpation. Let me know if you feel any tenderness again. Okay, no masses or tenderness noted during deep palpation as well. So now we are going to move on to the inguinal area. This is where I would check the femoral pulse, and I would ask the patient if she wanted that assessment done.
No.
So patient declined the assessment, so I would, if I were to do it, I would check the pulse in the inner groin area. So now we're going to move on to lower extremities. I am going to begin by checking and making sure. Okay, so no noticeable lesions on lower extremities, and there is a healed scar on the patient's left lower leg. There's also a tattoo on the patient's right lower leg. Patient also has a tattoo on left upper thigh. Hair distribution is even. No varicose veins noted. Now I'm gonna patient is cool to the touch. So now I'm going to ask you to, you can sit up now.
Okay. Like sit like this or like.
You can turn towards me, and I'll so now I'm going to check the patient's popliteal pulses real quick. Popliteal pulses are equal bilaterally and graded at a 2+. Alright, I'm going to take your socks off real quick. Now I'm going to check the patient's posterior tibial pulses. Posterior tibial pulses are equal bilaterally and graded at a 2+. Now I'm going to check the patient's duralis pedis pulses. Patient's duralis pedis pulses, both equal bilaterally and graded at a 2+. So now I'm going to go ahead and check for capillary refill in all of the toes. Capillary refill less than 3 seconds in all toes on both feet, equal bilaterally. So now I'm going to go ahead and assess and spread each toe and make sure there's no visible lesions on both feet. No visible lesions noted in between all toes on both feet, equal bilaterally. Now I'm going to check the soles of the feet on both feet. Okay, and I'm looking on the external extremities of the feet. Feet have no noticeable lesions or bruising. Now I'm going to move on and I'm going to do strength in the feet. So if you don't mind, I'm going to put my feet on the bottom of your sole and I want you to press down like you're pressing a pedal. Good job, thank you. Now I want you to point your toes up to your nose real quick. Thank you. So strength in feet was 5 out of 5. Now I'm going to test strength in legs. I'm going to put my hands behind your thigh or your legs right here, and I want you to press back away from me. Okay, thank you. Now I want you to push forward towards me. Okay. Patient's leg strength is graded at a 5 out of 5. Now I can ask you to lay back down for me, and we're going to do range of motion. So we're going to start with hip range of motion. I'm going to ask you to lift one leg up and then lower it back down. I'm going to lift this leg up and lower it back down. Now I'm going to ask you to extend this leg toward me and then back in, and then same with that leg. Okay, full range of motion in hips equal bilaterally. And now we're going to do range of motion in knees. I want you to bend your knee up for me and back down, and same with the other knee. Okay, perfect. Range of motion in knees was graded at full range of motion and equal bilaterally. So now we're going to do your feet range of motion. So I'm going to ask you to point your feet up to your nose real quick and point them back down towards me. Okay, perfect. And then can you just try to wiggle your feet and your toes? Okay, wiggle your toes and spread your toes for me. Okay, perfect. Full range of motion in feet and also full range of motion in toes, equal bilaterally. So now we're going to do full range of motion of your spine. So you can stand up for this one for me. Okie dokie. So I'm going to have you put your hands all the way up to the sky and reach down and touch your toes for me. Perfect, thank you. Now I'm going to ask you to lean like you're going to touch this side and lean like you're going to touch that side. Okay, full range of motion noted for spine. So now we are going to, I'm going to assess your gait, so if you could just walk forward for me. Okay, gait is normal. You can walk back for me. Okay, so now we're going to screen for scoliosis. This is our final step. Okay, so you could turn around for me and you can bend down and touch your toes. I'm going to feel your spine real quick. Spine is medial, no curvature noted, and hips and shoulders are symmetrical. Okay, you can stand back up. Scoliosis test is negative for scoliosis. You can sit back down for me. And now we are finished with the full physical assessment. So I'd have my patient lay back down for me. And I'd make sure that she was comfortable and she didn't need anything. I would raise the side rails and make sure the bed was locked. And I would put her call reach in her call button and reach for her. And is there anything else I can do for you today? Okay. Then I would be done with my full physical assessment.